In my opinion, if someone's smoking or vaping at school, it's disgusting.
Когда кто-то рядом вейпит или курит, я задерживаю дыхание, задерживаю нос и пытаюсь быстро пройти через этого человека.
I really hate having to walk into bathrooms at my school and immediately smelling the artificial scent of strawberry and lemon.
Unfortunately, I see many of my peers being exposed to smoking because their parents smoke or because of a massive popularity of e-cigarettes.
Діти часто піддаються впливу дорослих, які курять, або думають, що курити – це модно, але насправді куріння або вейпінг – це дуже шкідливо для здоров'я та може призвести до хвороб чи навіть смерті.
If I'm in the same room with the person that's smoking or vaping, not only put their health in danger, but mine as well.
Зачем придумали сигареты? Я не знаю, лучше бы их не придумывали.
Нет, сигареты придумали для того, чтобы поднять деньги.
Я считаю, что это яд. Нужно запретить в школе вейп и курение, все, потому что она вредит легким.
Such a ban would emphasize once again the harm of smoking and form important skills of caring for one's health and those around you.
For me, school is my second home personally because I spend so much time there, and I wouldn't like having smokers there, as well as I would not like having smokers in my own house. So if we all breathe clean air in our schools, students can study better, teachers can do their jobs better, and we can all be happy and healthy.
Now it's my great pleasure to extend a very warm welcome to our studio guest, Ms Anne-Sofie Flintrup, a proactive coordinator specializing in health and well-being of students within the public schools of the municipality of Brøndby here in Denmark. And also I would like to extend my welcome to Ms Manca Kozlovič, joining us virtually, and she is a youth activist from Slovenia who started her volunteer journey during her high school years in the youth network No Excuse, which is a national youth organization working in the field of health, environment and youth participation. So Anne-Sofie and Manca, we sincerely appreciate your presence here, and I eagerly anticipate our conversation. So Anne-Sofie, I wanted to start with you. Could you tell us a little bit more about your role and actually the question whether making schools tobacco-free is in your responsibility?
Thank you for letting me be here, first of all. And so I'm working with all of the schools in the municipal, and part of it is the risk behavior of youth, and that includes tobacco and nicotine products, and trying to help teachers and leaders sort of kind of like how do they help youth like use less of these products. Yeah.
Mm-hmm. That's great. I have some data here that I will look into. So back in 2019, apparently, according to the European School Survey Project on Alcohol and Other Drugs, shockingly 22% or every fifth of the 15 to 16-year-old children smoked cigarettes in Denmark. So I assume we can all agree that smoking, exposure to secondhand smoke, probably is an issue in Danish schools.
Yeah, so unfortunately it's rising, the numbers. I would have to say that I think in the survey it's also nicotine products, and we see that that's rising as well with the nicotine powder products, snus, and also vaping is like something that is very used. Mm-hmm. Yes, unfortunately.
Yeah. So what is the legislation like? What is the situation for these products that you mentioned?
So there was a new rule for vaping, and it included that if there's a taste within it, like a candy or strawberry, as we've seen, it's illegal. And that was a rule that's been activated, or it's been accurate after the data or the survey, but it's still an issue because youth and also young people can purchase these products through social media and like through each other. Yeah, so I think like it's good to have some rules about it, but they can still get it very easily.
Mm-hmm. So probably education and awareness raising is really important for kids to learn about the dangers. So could you share from your experience, what do you think are really effective measures educating children? And maybe you also want to share some lessons learned from things that don't work really well.
So first of all, in the public schools, we try to do like we try to look at what's actually going on in the classroom, because sometimes we would, when they're before the age you mentioned, when they're that's probably when they start in like high schools. So we're trying to like do surveys within the classroom, so they can see. First of all, they see how many they think have been smoking, and sometimes they point at like 25%, sometimes more, sometimes less. And then we would afterwards ask how many has actually tried smoking. And then often in those schools, we only see that it's like 2 pupils or like 5% or less. So it's actually like pretty good to do that, because then all the pupils would kind of like look at, okay, it's not like half or everyone has tried smoking, but it's actually only a few of us. So that kind of makes it more realistic. So that's a method we used with the children and also with their parents, and showed them, okay, so this is the actual picture in the classroom. And we know that's really good. So we don't have these like kids just doing things because they thought everyone did it.
I just wanted to ask you, because I think everybody agrees prevention is the gold standard. It's wonderful if you can prevent a child from starting to use these products. But I think we also need to find solutions for children that are already addicted to tobacco products or nicotine products. How do you deal with these kids in the schools that have become tobacco and nicotine free?
So that's a really good question. And I think often the most important is for the children to feel that someone is helping them. So they need to feel that someone is listening. So I think when we do have someone who's addicted, like we need to help them in a very proper way, with like having like really showing them that we're trying to help, and like with these different, there's also like really good hotlines to help. So like you can enter and just have chats. I know we have those in Denmark, and I'm sure we have all around the world. Yeah.
Yeah, and I think it's also really important to not blame the tobacco users or the smokers that they smoke and use these products, but our enemy really always should be the tobacco industry and not the users of these products. So coming back to some of the products that you mentioned, you said that these pouches you see more and more being used. Are there any other new and emerging products? Because we know this market is really very rapidly evolving, new products coming around all the time. Do you see any specific areas of concern?
So yeah, we do see the pouches. They're probably from high schoolers and above, mainly. We also see them a bit in the public schools, but in public schools we see these. They're called puff bars, which is like a vape, but they have often like 9,000 or 11,000 like kind of amounts in them, and they would be. You can't reuse them, and they often look really like a toy, and it's often really hard for adults to see that they're not toys and actually filled with nicotine. And they also, when they use them, they think they're really like tasteful, because it's either like candy or like some kind of fruits. They have like blueberry and strawberry and all sorts of different things. So I think it's really hard for children to know that how dangerous it actually is. Yeah.
And probably would be interesting for kids also to learn about the environmental impact of these products, because these are single-use plastics with batteries that you just throw into the normal paper basket. So probably that could be something where we could educate kids probably also.
Definitely. And the thing is, they're illegal here. Mm-hmm. And so I think it's both like telling them about that, because often I would think they wouldn't know, and also it's really difficult for adults to keep up, because it happens online, and when they throw them out, like sometimes they end up in a trash can at least, but often we also see them everywhere else, in like in parks or after festivals, or everywhere they could they could be exposed.
You mentioned that these products are illegal in Denmark. So how can kids buy them? Is it too easy for kids to get these?
It seems like it's really easy, yeah. And it's also for researchers, it's really hard to keep up because it's changing so fast. And I guess there are a lot of different ways of buying them. There are, for instance, they buy them online in their friendships groups, and we also see influencers with some of these devices on them, or like wanting to have, you know, like a way. So we both have the legal ones, which are with less like nicotine, and then we have the illegal ones, but it's hard for the kids, I think, to know which ones are legal and illegal and how many like nicotine amounts they have in them and all.
Wow. So thank you, Anne-Sofie, for sharing your experiences. I would like to turn now to you, Manca, and would like to say it's wonderful to have somebody like you, a young person who can really talk from her own experience. So thanks for joining us. Maybe we can start by you sharing what do you think about kids using these nicotine pouches or vaping in schools?
Also, thank you from my side for the invitation. I'm really excited to see what we will talk about today. First of all, I would like to emphasize that we're talking about kids. We're not talking about youth. So here in Slovenia, we see 10-year-olds using new tobacco products, and this is the most alarming part. It also came to, you know, a stage where everyone is concerned, not only the hospitals, the National Institute of Public Health, but also parents, also older youth, peers, schools, counselors at schools. So I think this really says a lot about the situation. Then if you would ask me why people do this, or why kids do this, and how did it come to the place we are at the moment, I would say that just how the marketing of the tobacco industry is really changing, and we really need to find or track these new ways of marketing of the industry to understand why this is happening.
Yes, yeah, I see that also in my children. You look at their phone, they're on Snapchat, and there is an influencer with one of these products. It's really a big problem. Going back to schools, Manca, if you could change one thing about schools in Slovenia, in your country, what rule would you make if you were to decide?
Ooh, that's a hard question. I think our schools are really well. In a sense that you, as a young person, you have a lot of support. But the problem is that there is more and more social problems, and counselors in schools do not really have time to deal with so many problems, individual problems. So if I would change one thing, it would be to give more support to the pedagogical workers or counselors in schools, so they would have more time or maybe more manpower to actually deal with these individual problems of youth. Because if we see why young people use so many, let's say, or want to be, I can say, let's say that they use products that are not made for them, they should not be using, is probably because they feel their mental health is not so good, because we really say that, I mean, it's not true, but they believe that if they smoke, their problems will go away, or they will heal their depression and so on. We hear these things when young people say why they smoke. So these are not really great reasons why to even smoke.
So going back to your experience, have you been to a school that was completely tobacco and nicotine free, or if not, do you think it's possible?
We have rules in schools in Slovenia. It's not permitted to smoke in the schools or in the field of a school, or I think it's around 10 meters away from school. So this rule is in the law, but we see that certain kids just move, let's say, 1 meter away from the entrance of school and smoke. But regarding the rules, they're there, and I think people respect them. But in the last school year, we saw not 1 cases or 5, let's say we saw probably around 10 cases of kids using new products in the classrooms, in the toilets, in the halls. And this had to, the teachers and the headmasters had to take certain measures for them to be punished, because it's a rule, and they, just did that without even thinking there is a rule. So we had to do interventions with these kids. It was really an individual approach to them to understand why they did it, how do they feel about this, why didn't they think about consequences, and we realized that it really is a call for attention, but in a sense that they do not have enough support at home to understand their own problems, and they do this because they want to be seen. So yeah, I would say there are rules, but we need to let's say adapt to the new circumstances we're under in the society at the moment.
Yeah, and this is what we learned also from Anne-Sofie, that sometimes it's really difficult to even detect these products when they look like USB sticks or like highlighters, so becoming more and more difficult maybe. So what can you share? What is your organization? Can you tell us a little bit, what are you doing? Are you going to schools, speaking to kids?
Yes, we are a national youth organization. We have 16 years now. The first projects that the organization did were mostly focused on tobacco-free spaces, or to change legislation to, prohibit smoking in closed public spaces. But the organization developed, so we now work in different fields of public health and sustainability. We have a lot of different projects. It's mostly a volunteer-based organization, and we are from 15 until 30-year-olds who do workshops in schools. We in recent years started to make more individualized programs for schools if they see the needs for that. We don't do only workshops in the field of tobacco, but also in the field of alcohol, mental health, peer-to-peer violence, and so on, really trying to tackle the problem of using substances, or let's say we try to do preventive work in a more holistic way, so we really can tackle and give kids and youth understanding what healthy lifestyle actually means.
Yeah. Fantastic. Great to hear about this work in Slovenia, and I could imagine that this peer-to-peer learning, if you want, is maybe also something for some kids that it's easier to get the message from somebody who is about their age than if a 60-year-old person talks to them. So thank you very much for sharing this, Manca, and thank you also, Anne-Sofie, for sharing your insights. So thanks very much to our panelists for this very lively discussion and for sharing these valuable experiences. I think it has become really clear that schools are in a quite unique and powerful position because they can play a major role in reducing the serious problem of smoking and other tobacco and nicotine use in kids. Because we have to consider that children spend, I think, almost 1/3 of their waking hours in school. And as we heard from Manca, a lot of the peer pressure kids encounter amongst themselves, they occur in educational environments. So this is why schools play such a pivotal role. And for schools to actively prevent and reduce tobacco use among their students, they have to create an environment that encourages them to be anti-tobacco, anti-nicotine, and really encompass these beliefs and behaviors. So we very much hope that our new guide that we published today and the toolkit will empower students, teachers and school administrators with the knowledge they need, and also provide some practical guidance really how they can go about making their school environment nicotine and tobacco free. There are 8 steps in this guide, and we hope that schools can have an enormous impact for current and for future generations for the health and well-being of their students. Thank you very much.